Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Professor James Galbraith, an economist at the University of Texas at Austin and director of the University of Texas Inequality Project. We speak about the state of the U.S. economy at this point in the pandemic, including why he recommends taking far more aggressive actions against the coronavirus now in order to strengthen the recovery. Let's listen. Professor Galbraith, thank you so much for joining me today. We've talked a lot on this podcast about the public health trajectory of the COVID pandemic, and I wonder if we might start by giving your sense of the economic trajectory of this pandemic here in the United States.
Sure. First of all, it's a pleasure to be with you and to have a chance to talk to you. I think it's fair to say that as the pandemic began, most economists and other commentators, and certainly the political leadership, in thinking about the economic effects, basically had two views. One was that as soon as the pandemic was over, the economy would simply rebound, that there would be a sort of a natural elasticity to it. And that's a view which I never accepted from the beginning. I challenged it from the beginning, but I think it's becoming increasingly clear that challenge was correct. And the second proposition, which many people held, and I think political leadership held, was that there was some kind of trade-off between the dealing with the public health problem and the economy. This is closely tied to the idea that the economy was sort of elastic and responsive. And therefore, that if you didn't go all the way to deal with the virus, you would have a stronger economy. So in some sense, a trade-off between those two things. And that view is also clearly, I think, shown to be incorrect, that the strategy of trading the economy against the virus meant that you effectively haven't controlled the virus and you haven't got a responsive, strongly resilient economy either. So those two questions, I think two aspects of the way in which people should be rethinking the assumptions they brought to this 4, 5, 6 months ago.
So here we are mid-September 2020. What is your sense of where the economy is right now?
Well, we're at the end of a period in which things were held up by the actions that were taken in April, by the CARES Act, by the extended unemployment insurance, by the payroll protection program, and by the large, if you want to call it a slush fund that the Federal Reserve extended to major corporations. Apart from the Fed's actions, which are ongoing, these other things are basically being wound down, and they have not yet been renewed. Congress hasn't acted on extensions. A major thing of protection against evictions and foreclosures has been extended, but I think many people are not aware of that. So you're looking at maybe almost the edge of a cliff in which major long-term damage that the pandemic is going to do, which has been unfolding over the last 4 months, could get dramatically worse if no further actions taken in the short run.
What would that look like? What is your concern for the U.S. economy?
Well, ultimately, it's observable in the storefronts in all the major towns and cities of the country. In fact, all the towns and cities, you can see places that are boarded up that have been abandoned. It's ultimately in the inability of the job-providing sectors of the economy to carry on. Now, people are going to stay open as long as they can, and maybe they can get some forbearance on their rents and mortgages. But ultimately, it's very hard to sustain this whole structure of job-providing services when customers are not coming through the door and the bills you have to pay are still piling up.
How does the continued transmission of the virus cause that problem from an economic point of view? Is it that people don't want to go out and shop? Is it what's the connection between people getting sick?
Well, there are two things. Immediately, it's people being careful, and rightly so, about their health. So if you can simply by keeping those kinds of interactions to a minimum, get the virus under control, which has happened in at least some countries, including it happened in China, then you can resume activity. But there's a second factor, which is peculiar to more advanced economies, economies that are more dependent upon household debts, where people have homes and they have mortgages and they have rental payments and they have utility bills and everything else, which is that people tend to, they're looking forward at the future and they're not sure about their own jobs, which are mainly also in these service providing sectors. When they get some relief, when they got a payment in April, May, June through the unemployment insurance or the stimulus package, they store it up quite reasonably. So they cut back on all of these activities, which are providing everybody else with their jobs. And because they figure, well, I've got a rent payment coming up in September, October, November. I want to make sure even if I don't have a job, I'll still have a house. And so you get this kind of retraction, and that's going to go on for as long as people feel uncertain about the economy. It won't go away if we suddenly tomorrow had a safe and effective vaccine or a really good set of therapies. People are still going to say, well, yeah, that's great. Or maybe I could go back and start patronizing all of these services that I used to go to my coffee shop, out to a restaurant, to bars and nightclubs and on to leisure travel of various kinds. But so long as they can't be sure about their own jobs, they're going to be very cautious about doing that because they want to make sure they have resources to meet their fixed obligations. And that's the real problem the real problem of resilience that you have from an economic standpoint.
So it could have been handled differently?
Yeah, I mean, it certainly could have been a fully coordinated, effective public health response that got this problem under control in April, May, June, would have meant that you would then be in a stronger position to reassure people you were really in control of the situation. And then maybe you get a kind of virtuous circle where I go back to my old habits and you go back to your old job and we're both happy. But that didn't happen. And it's that much more difficult to have a second go at it. Maybe the right thing to do. I think it probably is the right thing to do. But there's no question when you fail to persuade people that it was effective the first time, you're going to have trouble persuading them that it will work the second time.
So you signed on to a letter that called for more aggressive measures right now against the virus for the purpose of giving people that economic kind of confidence and hopefully
making it possible for them to have it later.
Yes, making it possible for them to have it later.
Yeah.
Tell me a little bit more about that argument.
Well, it's a straightforward argument is that what we should do now, what we should have done in April, which is have a coordinated, effective national effort to get this whole business under control. And I think that's still the best path forward, but I would be overstating the point if I didn't concede that it's going to be more difficult to do it a second time or a third time when you couldn't get it right the first time. The advantage now is that perhaps some of the actual uncertainties about what it is that is effective are somewhat better resolved than they were in February, March of this year. And we already know that the government was in the business of actively misleading the public about these for a number of reasons. It was misleading the public about masks, because ostensibly, if you want to credit a motive that they needed to conserve them for very short supply for critical workers, for healthcare workers, it was misleading. The president was misleading the public about the transmission and extent of the risk, and something apparently knew very well. And the journalistic community, and specifically Mr. Woodward, were not revealing what they were told in February by the president about what he knew. So we have a real problem and it's a problem that gets worse of the credibility of the official sector. If they don't establish it the first time around and aren't honest with it, then people are rightly going to say, why should I believe them now? But that said, I think we do know that the relative risks are in closed spaces. It's airborne transmission. Masks are protective. We know things that were not so clear. We know the whole business of touching of surfaces and so forth is perhaps not as serious a question as we thought it was in the early part of this. So we have some advantages in terms of definite knowledge that weren't there 6 months ago.
Great. I wanted to ask you two more specific questions about the economy. One has to do with schools and K-12 schools in particular, because a lot of the uncertainty and nervousness is sort of made tangible in these discussions around the schools. Many parts of the country still not open for any in-person schooling, and other parts are doing hybrid. Do you see that as a major issue for the economy, or is it just sort of a minor issue that relates to, parents and children?
Well, it's a very significant issue. And as obviously we have a great many school children in the country. And thinking about this, I think, in a proper way, and thinking about it also at the level of colleges and universities. The in-person experience is, deeply risky. We're certainly discovering this with the schools are not set up for social distancing. And certainly colleges and universities are not set up for it. So that sector, which is dealing with people who have options, who ostensibly can decide to not go or to defer, was caught in a real cycle of uncertainty, or maybe some wishful thinking and maybe some actual dishonesty in saying they were going to reopen, and then discovering, of course, as soon as they did, that people started getting sick in large numbers and they had to close up again. To me, that was obvious that was going to happen, but I don't know whether it was obvious to everybody who was making those decisions. In terms of coming back to schools, just so I don't lose your train of thought, in all of these activities, it's quite possible. I mean, the technologies do exist to move things to an online setting. I mean, it's obviously with small children somewhat more difficult, but it's not impossible. But what you need is to have more people. You need to have more people teaching. And if you were thinking about how to do this, you would be adding to your personnel and then using the distributed technologies in a creative way. And that's, of course, what also wasn't happening, because you need to have obviously a lot more funding. And you need to say, okay, we're going to hire people. We're going to get people in place so that we can meet the need to take care of carry on the educational mission while the pandemic is going on. But you need to have less siloed funding sources for state and local governments, which are, of course, in a position where they're cutting rather than expanding, because the whole system is not functional for the kind of challenge that it's facing now.
So in a way, schools are a microcosm, I think, for the way you're thinking about this, because had there been better control of the virus, then schools could have opened a lot more confidently with the parents able to go back to work. And now we're not only not in that situation, but we're not providing adequate resources in many places for the schools to even do.
Sure. We didn't mobilize. We took, and again, I say that the economics profession is maybe not the most culpable here, but it has a responsibility. If you take the view that the economy is going to just be very elastic and rebound as soon as the problem's over with, then you don't really need to do anything. You don't need to restructure. You don't need to mobilize. And that's the easy way out. But that's not the way the economy works. We have a false view of it. And so we failed to take actions that we should have taken. There was some rhetoric about this being like a war. But, frankly, we didn't act like it was a war. In a wartime situation, you stop doing what you were doing before and you restructure very quickly to meet the immediate challenge. We didn't do that.
Thank you. Let me ask one final question, because I know that you have spent a lot of your career thinking about the challenge of inequality. And we've seen with the economic impacts of the pandemic that they have not fallen equally across the population. They've hit already low-income populations, minority populations very hard, in tandem with the fact that you have more disease in those same groups. How should public policy think about, and I'll give you plenty of room to answer this question in any direction, but the urgent issues that are happening now affecting low-income communities, as well as the longer-term needs of the economy in that direction?
In the short run here, we did see the advantages of the rapid distribution of money. The fact is that if you, and doing it in a flat lump sum, $600 a week, meant that rather than calibrating it to everybody's previous pay or their earnings, meant very effectively that it was actually really quite a progressive thing to do in important respects, because it meant that a great many people were actually getting more support than they had been making while working, and they could save up something so that they could carry on for a period after the support ended. This is a very useful lesson. It tells you that the government can, in fact, buffer low-income and vulnerable people. And, of course, there were inefficiencies and gaps, in particular people who had trouble with, who were undocumented or had trouble with documentation, where, of course, were, all of these issues. But actually, even in the stimulus package, which was the direct payments to tax filers, they quickly set up a website where you could file a tax form and become eligible for it. And that happened really it was actually more efficient than I thought it would be. So those lessons are there. You can, in fact, buffer vulnerable people if you have the will to do so. Now we're seeing that, in fact, that will to continue doing so isn't there. And people who were protected from April through August are not going to be protected going forward unless Congress gets its act together and extends all of this and gives it another run. So that would be my major answer. It is, of course, true that in this situation, we also had some increased concentration of wealth. We had people who took advantage of the fact that the markets were going to collapse and sold them short. We have people who are in a very strong position because their business models actually benefited. I mean, people who are in the business that Amazon's in, for example, benefited from this. And so we need to be aware that there's a major task of evening things out and preventing a deeper concentration of wealth, even deeper than the fantastically deep concentration we already have. That needs to be part of our agenda going forward. So there are two sides of this: protecting the vulnerable and making sure we don't, or at least recognizing that we have to actually undo the concentration of wealth and power that's actually turned the United States into a kind of oligarchy that everybody's aware of, in which we have a small number of very wealthy people running the show.
Professor Galbraith, thank you so much for your time with me today. Really appreciate it.
Thank you. It's a pleasure to be with you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.